Welcome to the Beverly Hills Plastic Surgery Podcast. I am Dr. Millicent Rovelo, and I am here today with my increasingly svelte co-host, Dr. J. Calvert. Doctor?
I am definitely going that direction. Thank God.
Thanks goodness we have a Equinox right down the street.
And I am eating less and moving more, which is the recommendation of Jillian Michaels.
Yes, that is the key of just about every fitness instructor and doctor out there. And the reason this is important is because the topic of today's podcast is weight and obesity as it relates to plastic surgery.
It's very relevant.
Very relevant and a bit of a sensitive topic. And it's sensitive because obviously you don't want to upset anyone or make someone have to think about their weight because that can be upsetting. But at the same time, weight has a very real consequence and has potential for very real outcomes and complications in plastic surgery. And it's something that we do have to address.
Well, we do because a lot of times there are issues related to obesity that bring people to the plastic surgeon.
Right. And that is part and parcel of it. So there are issues related to the safety of surgery, of plastic surgery in increasingly high BMIs. There's the issue of complications that arise in patients that have elevated BMIs. And then there's the issue of aesthetic outcomes in patients with elevated BMIs. And I think it's important to sort of go through all of those. So the most, common thing I get and that we sort of have to go through is a patient that comes with an elevated BMI. Let's go through the BMI system real quick.
Right. This is an important thing because BMI it's used by doctors, by insurance companies, by fitness instructors. BMI is a very useful, although I think it's flawed. It's a useful measurement to start from. And the way that you calculate BMI is through it stands for body mass index, and it's your weight and your height.
It's height and weight
kind of compared to each other. So if you are 5'10" like me and you weigh 190 pounds, you are actually overweight. And thank you for playing. I'm just going to put that out there now. So, yep, that's right here. That makes you overweight. My BMI is 26. 25 would be normal. In fact, my doctor has told me she'd like me to weigh 160 pounds.
That's too small. You would just I wouldn't even be able to see you on this couch. I'd be like, Dr. Calvert, where are you? Where are you?
I think I would be dead. Actually, I think of 160, I would be just not viable.
Right. And so there's interplay with the numbers, but in general, quote, normal weight is a BMI of 20 to 25. Anything over 25 is considered overweight. Anything over 30 is obese. Anything over 35 is morbidly obese. Then over 40, it's super obese. And then there's super massive obese. So there are different increasing labels for it. But by definition, over 25 is overweight, over 30 is considered obese. And so those terms don't really matter too much, but the numbers kind of do. And so when someone comes in with a BMI of 39, 40, 41, and they say they want liposuction or they want a tummy tuck because they want to be smaller, reasonable. I mean, I get it. But the thing I have to tell them is that plastic surgery is not a weight loss solution.
No, you don't get skinny from plastic surgery. You don't get skinny
from doing plastic surgery. Body contouring, tummy tucks, all of those things, even liposuction, are really designed to sort of complement weight loss. They're designed to fine-tune areas that are prone to gaining weight as opposed to other areas. They're designed to remove excess skin after babies, after weight loss, things like that. They're not designed to remove weight off of you necessarily. That being said, I do have some patients who say, well, I'm never going to lose weight. This is the size I am. I've tried and tried and tried, and this is the best I can do. And then we have a very honest conversation about, well, what can we do? And it's going to take a lot of stages. So I have some patients where I've done a couple of rounds of liposuction on them. And now we're ready for a tummy tuck because now I've reduced the size of you to a degree that I can do a tummy tuck. But it takes a lot of work and a lot of effort. And that patient right out of the door is not a tummy tuck patient. No. So the expectations have to be there about what plastic surgery can and can't do for someone that has too much weight on their bodies. And then the other question that comes up with someone that's very overweight, and I'm talking BMI is getting up there around 38, 39, 40, is that are they safe to have surgery?
It's a big issue.
It's a big issue. And the short answer is yes. BMI of 40, probably safe to have surgery. We do it a lot for lots of other procedures, mastectomies, lap choles, gallbladders, appendix. All these patients who are overweight have surgeries for other reasons.
But can I ask you a question?
In general, they do okay.
Well, let me ask you a question.
Yes.
I have right here.
Yes, doctor.
Is a patient with a BMI of 40 an ASA 1 or 2 for a surgery center like ours?
I don't know the ASA class, but I do know that.
And by the way, for Tracy in Wisconsin, that is that's Jason Bateman always says that on the Smart List podcast. So I've picked it up for Tracy. Tell us for Tracy in Wisconsin. So for Tracy in Wisconsin, an ASA is the anesthesia safety assessment or something
like that. Yeah, like how safe you are for anesthesia.
But we call it the ASA class, and we know that 1 is somebody who is like totally healthy, expected to survive surgery. ASA 2, totally healthy, a couple comorbidities, safe for surgery. ASA 3 is like not so great, and ASA 4 is like probably not going to survive the operation. So ASA 1s and 2s we do in our surgery center. ASA 3s, like I don't know if BMI 40 is like a good idea in the surgery center.
Well, I think we do have rules for our surgery center, because I have had 1 or 2 patients where I had to go to our anesthesiologist and be like, hey, can we do this patient here? They have a BMI of 43, whatever. And they were like, actually, no, we can't. By quad SF rules or whatever that regulate our surgery center, we cannot do a patient with a BMI of whatever.
Okay.
So yes, because the BMI does increase your risk of surgery. Now, the other surgeries that I mentioned, mastectomies, lap choles, lap appies, those are cases that are done out of necessity. The patient has a problem. They need a surgery to fix it. Whatever weight you are doesn't really matter because you need that surgery. Same thing for bariatric patients. They have BMIs of 50, 60, but they need a surgery to help them lose weight. So the BMI is of less importance. Not to say that they aren't at higher risk of complications, but those surgeries are indicated and so they are done. But when you come to plastic surgery, outside of the cancer reconstructions and things like that I do, for the most part, what we do is elective. It's not necessary to save your life. You don't need this surgery. So, and I think I probably speak for most plastic surgeons, when we start seeing those elevated BMIs in patients, we say, whoa. You're going to have lots of complications. You're at a high risk for a lot of things. You don't need this surgery. I don't feel comfortable doing it because you are a setup for lots and lots of problems.
I want to just say that I think I have saved somebody's life with a facelift. So I'm not sure that no, I'm just joking. But it is true, though. Our surgeries are elective, and the complication rate in the patient who is in that obese and morbidly obese category is way higher.
Way higher.
And I think I can sit here and say that with body lift surgery after weight loss, like the circumferential body lifts and the medial thigh lifts, the complication rate is like 100%.
I think I quoted a lady yesterday at 110% because I looked at her and I was like, nope, just nope. It was the complications were going to be astronomical because she had a BMI of like, I don't know, 45 or something. I can't. The complication rate is too much. Now, what's interesting. I literally and actually can't even. Yep. That's for Cindy in Los Angeles.
Exactly. That is a very LA commentary, but it's true. It's like I can't even because you know what's coming.
And
pulmonary emboli, difficulty with extubation, DVTs, wound complications, blood loss. Like an ER, like book your ER visit. Book it. Like you're going to have it.
And I think the population where I definitely do my higher than BMI of 35, 40 cases are probably my breast reduction patients because a lot of times they do have higher BMIs, and I think it's kind of cruel to make them lose weight to have a breast reduction because a lot of times the reason they can't exercise is because the weight of the breast. So unless they're like a super unhealthy person, the BMI in that particular population for me is of less importance because I'm like, oh gosh, they really need their surgery.
Of course.
I say that though because I have noticed anecdotally in my own practice that the patients with higher BMIs and larger breasts are in that 100% risk of wound breakdown. But then I do have some patients with her totally normal BMIs, but just happen to have really large breasts. I rarely have any wound breakdown issues in those patients. So that comment of, oh yeah, breast reduction is 100% risk of wound breakdown seems to apply to the patients that have that elevated BMI. And the reason for this with the obesity and the risk of complications has to do with exactly that. It's wound healing issues and capacity. Fat does not have great blood supply. And when you're trying to close wounds that are comprised mainly of fat and that you're stretching over, tight closures, the blood supply just isn't there. And it's going to break down and it's not going to heal well. They'll heal eventually, but there are going to be some hiccups along the road.
Hiccups is the understatement. It's like, so these are such bad problems too, and it's like, and I'm not saying that you can't do surgery on people that are in those BMIs. You can. The understanding just has to be there.
It has to be there.
You have to get, this is hard to do, considering and wound healing. So plastic surgery is a battle of beauty versus blood supply. That's what we do. We look at skin on the face. We lift up the nose. I don't do medial thigh lifts anymore, but like some people look at the medial thighs and say, how am I going to get that skin up? Other plastic surgeons other than me. Tummy tucks. I'm going to pull that whole, it has to stay alive.
Yeah.
And in order for it to heal, it has to have blood supply, because blood brings oxygen. It brings white blood cells to fight infection. It brings growth factors. It brings inflammatory mediators. It's all the things that we know as doctors that are needed and necessary for wound healing. And if you don't have those things, because it's fat, which has a big oil blob and one little tiny cell, carrying that oil blob around like somebody who's got to carry, their luggage filled with bowling balls around, it's not going to heal.
It's not going to heal.
It's not.
It's really hard. It's hard. It's hard to heal these wounds. And in general, especially for the work that I do, the body contouring, breast reductions, these are big incisions as it is. So you're asking the body to
maximally invasive
heal
surgery.
Large areas of incisions. So, and it's wound healing. It's fluid accumulations. Those are called seromas. It's wound infections. It's bleeding after surgery.
Totally.
Because even though we say that fat doesn't have a lot of blood supply, there are still a lot of really big blood vessels that go through the fat.
Something's keeping it alive.
So bleeding is an issue, and it's problematic, which is why I have some colleagues who are like, BMI over 35, not doing it. I mean, they have a hard and fast rule, and I'm like, wow, that's harsh, but they're adamant because they don't want to deal with complications. They don't have room in their own personal lives to deal with complications, and for them, it's just easier to say BMI over 35, not doing it, not worth the risk.
That's right. There's a surgeon in Beverly Hills named Dr. Rovelo, and she can help you, and that's where you go.
I have a BMI cutoff of 50. No, no, but I do. I definitely do work with my higher BMI patients because I get it.
Yeah, and somebody. And the reason that we're having this discussion is not because you can't have surgery at those BMIs. It's because you need to have an understanding. You need to know what you're signing up for and say, okay, I get it. And when and if this happens, I am going to be helpful in the cause. I'm not going to eat bad foods and all the things that can. I'm going to really be on top of it. And it's not that. I think people have such misconceptions about weight loss too. Like they think that starvation is a way to lose weight. It's not. Weight loss is all about balance. In my own fat self here at my 26 BMI, if I wanted to be 23, I could do it, but it would take time and focus, and which is hard. Which I don't have a whole lot of that. I've 4 kids, a booming practice, and this podcast, which takes all of our time. But it's just there are things that interfere with me focusing to get that to that 23 or 24 or whatever. It can be done. It's not an emergency. 26 isn't terrible. I'm good. But if you want to go from a 35 to a 27, like that's a Herculean effort.
That is very hard.
Do you agree?
That is extremely hard. And outside of, bariatric surgery, it's insurmountable for some people. And I have some people who have done it on their own. I have one lady who's, she got a divorce, bought herself a Peloton, dropped 100 pounds. Like, best thing that ever happened to her.
I think the divorce was probably the key in terms of her getting the time that she needed
to get on that Peloton.
Because you have to focus.
Yeah.
I'm not saying that everybody wants to lose weight should get a divorce, but I'm saying you have to have time. And it is all about balance. And I love Jillian Michaels because she's so bare bones about it. She's just like, it's eat less, move more. Not don't eat. You do need to eat.
Right. But it's what you eat, and it's the quality of what you eat.
Totally.
But easier said than done, which is
I know, because Betadine Bay, our scrub tech, was in there yesterday.
The feast.
With a just random day selected potluck for lunch. And of course, I had to try everything because, it was so good.
Looked delicious.
It was great. But that doesn't help, so you have to really say, okay, how much exercise do I need to do? How much? And when getting ready for surgery, starvation is actually one of the worst things you can do.
Yeah, don't do that.
Because you're causing a metabolic deficit and probably not getting enough of the normal cofactors and the zinc and the molybdenum. There are things that you need in your food that if you're starving yourself ain't going to be there for your operation.
Yeah, you do need to have good nutrition going into surgery. That being said, if you have a surgery, a lot of my patients are booked out, a couple months. Is a good goal, because if you only want to lose that extra 20 pounds, hey, your surgery's 3 months away. Getting down 20 pounds will be great. That's a good goal. You have a date to get there by. And it'll make your surgery better. It'll decrease your risk of complications. You'll have better outcomes. So I do think it's helpful for patients to have like a goal, a reasonable goal that they can get to with, healthy practices. Because the other aspect of this, we've talked about the safety and the feasibility of plastic surgery in overweight patients. And then the very last thing is, well, what are the results going to look like? And
that's the key.
It's
the key.
hard.
That's what it's about.
I want my patients to look amazing after surgery. Sometimes that's harder to do in patients that come with extra weight. It's just harder to get that wow factor.
Yeah,
Although I have taken off lots of weight and skin in patients, and there is a wow factor. But it's a lot harder when you come with extra weight to get down to, that Instagram model look. And to be fair, most patients totally understand that. They're like, I get it. I'm not going to be a bikini model after that. I just want to look better. But one of the best ways to have a better after result is to come in at a lower weight, because I can do a lot more with that.
But that that's the key, because so many patients think they're going to be skinny when this is over. I'm going to be skinny afterwards, and that's not the case.
Yeah,
that's not the case.
Plastic surgery, not a weight loss option.
No, and I have had patients say, I thought I would be thin after this, and I said, no, we talked about it. I said you were going to be less big,
thinner. Well, a lot of the problems I see with my liposuction patients and my tummy tuck patients too, to a fair degree, is that I can do a lot of liposuction on the outside, but I can't liposuction what's on the inside, which is the visceral fat.
Yeah, the
visceral
intra-abdominal fat
is inside the abdomen. That means it's under the rectus muscles. It's wrapped around your liver and your intestines and your stomach. The only way to get rid of that is through diet and exercise and actual weight loss. I can take away the fat on the outside, but it's the fat on the inside that makes your abdomen stick out, stick forward, look protuberant. And I can't fix that. Even with a tummy tuck, even with muscle tightening, that's internal fat. And that's going to be weight loss.
That's up to you. You got to do it.
That's the key on that one.
So let me ask you some questions that the patients always ask me, and then you can tell me the answers.
Yes,
excuse me, doctor.
yes, patient, yes.
I am having liposuction. How much weight am I going to lose after you do my liposuction 360 with the Renuvion?
Maybe about half a pound, maybe.
But can't you take out 5,000 cc's of fat in the outpatient setting? Because I read that on Real Self.
It's true. I can take out 5,000 cc's of fat in the outpatient setting.
So won't I be 10 pounds less heavy?
No. Those fat cells really don't weigh that much,
No.
which is ironic because when you are technically fatter, way more, like it seems to go hand in hand, but it really doesn't, because a lot of what you get as actual weight is not fat cells. It's the collagen, it's the extracellular matrix, it's the skin growth. That is what adds heft and weight. The actual little fat cells don't really weigh that much. And that's what's being taken out in liposuction. Now, when I do my big body contouring cases, my 360, body lifts, my big old tummy tucks, and I'm actually taking whole blocks of skin and fat and tissue off, there is some heft there. That's easily anywhere from 5 to 20 pounds off.
Yes, you will lose weight with the body lifts.
Yeah.
Okay. Okay. Next question. When will I see the result from my liposuction case? And do I need to go buy new clothes before surgery?
No. You will see a result right away, in the sense that you'll look a little smaller, but you're going to be really swollen. And that swelling will start to go down over the next week or two. By 3 weeks, you'll start to see some of your shape coming in. By 6 weeks, you will be about 85-90% there. And at 3 months, you're more or less the size you're going to be. So I would hold off on buying new clothes until you're about the 6-week mark.
Since you're taking all this weight off me with the liposuction, the whole half pound that you talked about, should I eat whatever I want before surgery and gain some extra weight?
No, that's not a good idea. Although it's not a bad idea.
It sounds
either.
really good, though, because I'd really like to have some extra burgers and some milkshakes.
It's actually not a bad idea. I mean, you can't, gain like 50 pounds. But you have to keep in mind that when you overeat, the weight doesn't come on right away.
No, it doesn't.
It usually takes like a week or two to show up in your pant size. So yeah, if you have a certain area where you are prone to gain weight, and that's the area that I'm doing liposuction on, sure, gain a few pounds. I'm probably going to take it off.
Awesome. I love that.
But then stop afterwards.
Well, that's the problem.
Yeah.
So the reason that I like that question, and they do ask me that, because it gives me the opportunity to explain to them that when you stress the system of your physiology, of your metabolism and your digestion and your homeostasis of what you're doing with fat building and breaking down, it changes your physiology. And so I always tell people, whatever you do normally, do that before surgery,
normally.
because
Yeah.
you don't want to change things.
No.
Because that can have some effects that we may not like. So I say keep it real.
Yep.
Stay with what you're doing.
Do your normal.
And you'll get better results with that approach, rather than saying I'm going on a starvation diet so I can be skinny or thinner or whatever. Because that then hurts your metabolic makeup, and then trying, like I'm going to have 17 milkshakes before this operation. If it, kills me, well, it may kill you, because, then you're glycosylated and whatever, bad things come with lots of sugar floating in your veins is going to happen also, which is not good.
Right. Got to stay in your normal healthy range before surgery. But if you have the time to lose weight in a healthy manner, that's always helpful if indicated. And yeah, I mean, BMI, not a super major, contraindication to surgery in my practice, but you do have to know that you are at a high risk for complications. I know I have some colleagues who, for breast reconstructions, won't offer reconstruction to patients with high BMIs. They're like, nope, sorry, no breast reconstruction for you. That's a little harsh.
Wow.
I'd rather be like, we can do this, but here's the problem. These are the problems I see. And if you go into it and you're informed and something happens, at least you are aware of it. But just having that hard cutoff, that's not for me.
Well, that's good, because I see you do some absolutely miraculous transformations on some people that, I just would look at them and be like, nope. Hell no.
I'll
No
do them.
way.
I do a lot of these big body patients, but
And you
all
kill
of
it.
them,
You are awesome at it.
they have to be healthy as well.
And they got to play ball with you.
And they do. Thank God.
And
I
you
have good
you
patients.
make them you give them the lectures and say, this is how this is going to work. And they fall into line and they get great results because they follow directions.
Agreed.
Yeah, I mean, the stuff you do, kudos to you. I mean, who knew that, you would have this practice? Like when you came out, I was like, I thought you'd do a lot of breast reductions, like some noses and, some lipo. And like you definitely are the transformation surgeon for people that are on their weight loss journey, that are on their body lift journey. I mean, those are hard operations.
They are, but when you can get a good result,
It's awesome.
I mean, it's amazing. For me, for the patients, it is super rewarding.
Well, that's because you're young and have a ton of energy. And I used to do them too.
It is.
I did.
Physically draining.
They are tough, and I did
Yeah.
those operations, and I still do a little bit of like tummy tucks and stuff like that. But what you do, that's those patients go to you. That is your thing. And
So if
thank God.
I have said no to you because I'm concerned about your medical problems and your weight issues, you got to take that pretty seriously.
You do.
Because I'm usually the yes person.
Yeah, I'll tell you, Dr. Rovelo is definitely capable of some things that are really, really amazing. I'm blown away by those operations. So good on you and good for your patients. And be a good patient if you're listening. And definitely, follow the directions because it makes a big difference.
And I think that's pretty much it. That is our podcast on the effects of weight on plastic surgery. This is the Beverly Hills Plastic Surgery Podcast, coming to you from the 90210.